Hi, my name is Ashley Linton, and I will be speaking today about communication. Communication skills are necessary in order to become a successful nurse. Communication with physicians, patients, families, and other healthcare providers is important. Oftentimes, preventable medical errors occur because of miscommunication. In order to lessen these errors and provide better patient outcomes, we must learn to communicate. Nurses, healthcare providers, and physicians often feel as though they're unable to communicate because of the staff workload, conflict, or the time that affects how they're able to communicate with others. Patients often feel like they're unable to communicate because of lack of privacy, they feel fearful, they're anxious, or they feel as though they may be judged by the way that they have questions or concerns. As nurses, we must learn to listen in order to communicate with our patients. The best way to do this is by doing our bedside reports and including our patients and their families. When we do this, we are able to communicate with them so that way they understand everything, and if they have questions, they feel as though they're being addressed and they're being communicated with. As a team leader, I often find myself rounding with the physicians when they come on the unit. The nurses have already spoken with me about different issues that may have risen up that need to be addressed with the physician. And as the team leader, I am able to communicate with each physician and get anything that needs to be done addressed with each patient. The article that I chose to look up involved communication in the ICU and how it affects patient-centered care. Among the different interviews and observations, it was felt as though nurses were communicating with their patients and families and were providing patient-centered care by communicating with others as well as the physicians. We must all learn to communicate with each other in order to provide the most patient-centered outcomes and provide the best patient-centered care. We must learn to develop professional relationships with our patients in order to provide the best care and communicate with them. I also, as a team leader, I find that there are issues that come about that patients feel they may not have been communicated with. And a recent example included a family member who was not informed of her brother, who was not able to make his own decisions, of a diagnosis of Shigella and C. diff. She was notified by the health department of the Shigella, but was never notified by the hospital, the physician, or the nurses of what was going on. She did not feel as though we were communicating with her. Unfortunately, this is seen more than we would like, and as nurses, we must learn to communicate with our patients as well as their families and with other physicians and healthcare providers in order to provide the best patient-centered care and get the best patient outcomes. Thank you.